A live look now at the U.S. Capitol, where the House is set to debate the new GOP healthcare plan this week. This is lawmakers' final work week of 2025. Now, the proposal would expand the availability of so-called association plans to allow employers to join together and buy coverage. And it would impose new transparency requirements on pharmacy benefit managers to lower drug costs. But the plan does not extend Enhanced Affordable Care Act subsidies, which are set to expire New Year's Eve.
Tens of millions of Americans are now about to experience dramatically increased health insurance premiums. That's totally unacceptable.
We have the tool in the toolbox to make another unilateral Republican run at reforms that we believe will bring the cost of care down.
Now, the House is set to vote on the proposal sometime this week, but even if the measure clears the House, the Senate is unlikely to take major action on health care this week, so those enhanced ACA premium subsidies are all but certain to lapse. So the debate in Congress continues about what to do with those subsidies for people who get their insurance through the Affordable Care Act, and there is a lot at stake, even for other people, right, who get health insurance through their employer or another private plan. So I wanted to chat with a couple of experts in this area. Dr. Francesca Weaks and Dr. Mika Hamer are with the University of Maryland School of Public Health. Since those tax subsidies were introduced in 2021, 13 million people have been able to afford a health insurance plan. One consequence of those folks potentially losing insurance is hospitals having to spend more for uncompensated emergency care.
It means that they don't have funds available to spend on other things. So that might be innovation, that might be workforce and staffing, that might be, renovations to the building. And those are places where we all get care.
Dr. Hamer says eventually hospitals would raise their costs to cover the shortfall. And another prediction from our experts here, uninsured folks would end up delaying minor medical issues until they became major medical issues. And that could lead to a lot of people taking long absences from work.
What we're seeing is that there's a possibility, again, with our workforce, we could be building a less healthy workforce if we're not giving people access to affordable insurance so they can go and get health care.
Now, less populated in rural areas could be hit the hardest. Dr. Weeks says 750 rural hospitals across the country are already in danger of closing because of rising costs, and millions falling off insurance rolls could hit those hospitals disproportionately hard. So costs are already going up for everyone's medical insurance. Now, a recent poll found employer-sponsored plans for 2026 are going up 9% on average. That's the highest jump in 15 years. So without tax subsidies, ACA plans could see premiums double. And if millions leave the insurance marketplace, costs could increase for everyone else even more this time next year.